Hello, everyone. How's it going? Welcome to the Aidlink Town Hall webinar. There's some amazing people you're going to be hearing from soon. I'm going to introduce them in a moment. My name's Donald Scanlon. I'm delighted to be emceeing today and delighted to have anything to do with Aidlink, which is the most wonderful organisation in the world. We've a jam-packed event for you today. We're going to hear all about Aidlink's water projects in Africa and directly from some of Aidlink's Ugandan partners about the real impact of access to clean, safe water for communities. Just a little bit of housekeeping. Down the bottom of your Zoom screen, you'll see a Q&A button. If you click on that button, it opens up a place where you can ask questions, and we'll have a question slot at the end, and we could read your questions. So please put your questions in and your shout outs and your hellos as well, of course. I also need you to know that we're recording this event. You'll see a little red light flashing there. We are recording this and we'll be sharing this recording with everyone afterwards. So over the next hour, you're going to hear from Anne from Aidlink, and we're going to hear from Uganda live from various partners who are going to be presenting. Lillian in the red jacket there from the Voluntary Action for Development Group, Henry and Dan from Caritas Meadow, and Mabel from Arroway. So it's a very exciting, and I to be honest, my mind is slightly blown by the fact that we have Uganda and Ireland linked in this way, and of course linked by Aidlink for so many years, but now able to do this at lunchtime. I'm very grateful for the technology that allows this to happen. As I said earlier, about 1:30, we're going to have a panel chat, and your questions will be very important as part of that. So please use the Q&A function, ask your questions, and we will get back to them. So without further ado, I would like to hand over to Anne from Aidlink.
Great stuff. Thanks a million, Donald. Thank you, everyone, for joining us this afternoon. And I just said to our panelists before we went live that maybe they just brought a little bit of the Ugandan sunshine with them. It's certainly nice where I am here in Navan. Thanks too to Donald for joining us, and hopefully will keep us all on track for the afternoon. But a huge warm welcome and thanks to Henry and Dan from Osaka, to Lillian from Voluntary Action for Development, and Mabel from Arua. It's just fantastic to see you here and to have you here with us today. So thanks very much. The month of March is generally World Water Month, and a time when people take stock of where things are at. So while we might be a little bit behind schedule in trying to commemorate World Water Day, which is at the end of March, maybe that's a little bit of COVID and we're all a little bit behind track on certain things. We do believe it's very important just to take stock at this time and to consider this year's theme, the value of water. And it's certainly worth taking some time out to talk about that. I suppose in very simple terms, we would say that Aidlink loves water, and you know, we recognize its value, and that safe, clean water is really central to reducing inequalities and achieving the Sustainable Development Goals. As many of you know, I'm a nurse by profession, and certainly I think in the last 12 months, we have all discovered the value and importance of water, or it's become very central in our lives, and that maybe we wouldn't need hospitals at the level that we've needed them in the last year, you know, when using water effectively and well. I think also we've understood maybe the privilege of having such access to water that has not been shared throughout the world. So we are committed here in Aidlink to achieving Sustainable Development Goal 6, and that of clean water and sanitation for all. Just want to shout out to some of the schools, communities, and students that are with us here today. Over the last 6 or 7 years or so, we have partnered and worked with a large number of schools throughout Ireland on our Walk for Water campaign. Thousands of students have joined us in solidarity and in raising very valuable funds, raising awareness about the issue of water poverty, and raising funds that have assisted many, many, many vulnerable children throughout Kenya and Uganda. But, you know, there is more to do. Let me share my screen, and let's see if I can get the technology to work. And for some reason, maybe I can't. I can maybe. Today, just to say that we are really not on track to achieve our Sustainable Development Goal 6, achieving clean water and sanitation for all. Everyone, clean water, decent toilets, good hygiene and sanitation. They should be the norm for everyone, everywhere in the world. It is as simple as that. In Ireland, 97% of the population have access to a safe, clean water service. In Uganda, 7% of the population have access to a safe water service. And in Kenya, only 25% of the population have access to basic hand washing facilities at home. Aidlink works predominantly in ASAL regions. These are like the arid and semi-arid lands, deserts, I think we would call them. We work with the Maasai, the Turkana, the Karamojong, these communities who are living on the front line of climate change. These communities that are subject to drought and have been, I think, over the years. That's what the ASAL stands for, the arid and semi-arid lands. I think something that strikes me very often, though, is that, you know, 15 years ago in Turkana, people would have talked to us about drought coming every 10 years. It's now coming every 2. That has been the real life impact of climate change on some of the communities that we work with. And, you know, these communities are vulnerable and are exposed to the elements at all times. Also, you know, if you are a girl living in a desert, the impact of lack of access to water is absolutely massive. Girls walk in these communities, walk on a daily basis, an average of about 6 kilometers a day in search of water. Times of drought up to 15 kilometers a day. That's about, they tell me, 20,000 steps. I mean, I'm struggling to get to my 10 a day, and I don't have to carry a jerry can of 20 litres home with me for basic domestic use. It takes about 3 hours. And the impact of having to go and collect water dominates the entire day for girls. It has an impact on their learning. They get up at crack of dawn in the morning, they walk for water. It has an impact on their learning. It has an impact on their play and their opportunities to be a child. By strengthening communities' resilience and building sustainable water and sanitation infrastructure, this enables girls to reduce the time spent walking for water and increase their time in school and engaged in other activities. Adequate wash facilities in school, wash being water, sanitation and hygiene, ensure that girls are able to attend school first and then attend class, even when they have their periods. And it is something that we do have to talk about. With water and sanitation in schools, more girls enroll, more girls stay in class for longer. And when that happens, we're reducing the impact of early marriage or the incidence of early marriage and FGM in areas where that occurs. So for us in Aidlink and for our partners here on the screen, school is a really important place. It's a place of more than learning. It's a place of safety. It's a place of nutrition. It's a place of health and of course an opportunity for learning. And we are really keen that more girls go to school, more girls stay in school, and we believe that water, access to water, for the girls themselves and for their families is a key to that. We'd like to do more. We'd like to have more water points in more communities, more water points in more schools. So to that end, I'm going to stop for now. I'm going to share this platform with my colleagues in Uganda and hear from them from very much on the front line. Allow them to share their stories, and we'll talk again later. Thanks very much, everybody. Donald.
Wow, thanks a million. And God, it's amazing the thing that we take for granted here. You walk into the kitchen, you turn on the tap, and then to hear about those girls whose days are dominated by something that takes us seconds and we don't give it a second thought. Unbelievable. Lillian from Voluntary Action for Development, we're going to hear from you now. And if the rest of our screens go dark, it's just to give more bandwidth for Lillian. We all are still here. But Lillian, over to you. Thanks a million.
Thank you, Donald. Yes, once again, I'm glad to be here, and you're much very welcome to this presentation of webinar, WASH. So my name is Nashijoba Lillian. I'm from Uganda. I work for Voluntary Action for Development as a program manager. Yes, and we go on. Yeah, our presentation highlights. We're going to focus on introducing VAD, then our partnership, VAD and Aidlink, then why focus on water, then challenges of accessing clean safe water, focusing on our targeted area of Aidlink. Then we have to talk about impact of COVID on our communities and VAD plans for the future. Next slide. So about VAD, VAD is a local NGO which started in 1996. Our vision is that a health and vibrant self-reliant community, and we strive to see that we empower our communities to be self-reliant through our interventions like health, education, livelihood, and advocacy interventions. We focus much central and northern in central regions, but now our focus is 80%. 17, we decided to spread our wings in those areas of northeastern region. So the value of water justification, as Anne said, globally, we as VAD, we contribute towards Sustainable Development Goal 6. We want to see that all people, all human living have access to clean, safe water and have sanitation for all. Then when we come to the to advocate for water, for example, the Constitution of Uganda, 1996, says that we have a right, all citizens have a right to clean, safe water, but also ensuring that all citizens have to take part, have to participate, that water is nearer to us, and also making sure that we live in a good environment. Then you also have the Water Act 1996, which also advocates for provision of clean, safe water and having adequate supply of water at home. Then the National Environment Health Policy of 2005, which also stipulates that clean and healthy environment for all, ensuring that both in rural communities, urban communities have access to water. So next slide, Anne. Next slide. So challenges of accessing clean, safe water. Aidlink and VAD, we intervened the northeastern region, particularly in Napak, in sub-counties of Aidlink in 2017. So realized that before that, poverty was too high, whereby 80% of the population are earning below 100,000 per month. That is in euro. Okay, I'll forget, but 89% are subsistence farmers. So we saw that at least on a daily basis, all people there are earning below $1 a day. There's also a high disease burden. All these diseases are related to poor sanitation and having access to unsafe water. So we found out that 40% of the households are spending too much on medication treating those poor-related diseases, yet they can be avoided. So we saw that we have to intervene because it was the neediest areas to avert the pathetic conditions. Lack of self-clean water, we saw that 70% access water from the ponds, and mainly these are pastoralist communities who value their their animals so much. So we find out that they share water with their animals. Long distances, 60% walk more than 3 kilometers and spending a lot of time. Yet time would have been injected in other development activities. Also, women and children take the largest burden of accessing clean water, yet they have also to take care of their families, like searching for food to eat, taking care of their families. So really, those were challenges. Next slide. About the sanitation coverage, in remote areas, 3% have low sanitation coverage in trading centers. So open defecation was all over. You find that most of the areas are smelly with feces. So this was also a challenge to such communities. The area is also prone to long droughts, of which they value their animals so much. So you may find that they walk long distances of searching water for both for domestic animals and for themselves. When you find when you come with women and adolescent girls, they face a challenge of managing their menstrual period. So you find out that most of them were using old clothes, rags, leaves, because they cannot afford to buy one disposable sanitary pad of 4,000 UG, that is $1. So that's why we really wanted to intervene with support of Aidlink. So when you come to this slide, BAD has a number of approaches we use when we're intervening a place, intervening an area. Several approaches have been adopted. For example, we always do the consultative and planning meetings with leaders at different levels of government units. We have at the district, that's the biggest component in the local government. Then we come to the sub-county and parish. So this picture is seeing where in a dialogue meeting with the local leaders in a sub-counties, explaining our project, the strategies, and how we're going to involve in the implementation of our project. This was 2017 with funding from Aidlink. And after that, we always do baseline surveys. Baseline surveys help us to find a solution afterwards. So in most communities, in a petroleum, children study under the trees. So there is only one government-aided school, which is a petroleum primary school. So others are established by the community, by Father Mark. So you find that they study under a tree, too much sunshine, too much rainfall. So in most cases, they missed out the classes. So that's how we came with intervention of Aidlink and VAD to support these children. Another slide. Also the baselines, as explained in a previous explanation, you see in this first picture, how man is accessing water in that pond. It's so pathetic that even the animals can access such water. At the same time, this is the water being used at home. So that is a challenge. Also, girls walk long distance of kilometers, as you see them. They're really happy, they have nothing to do, but they are walking all the way to access clean, safe water. So you find that they miss out classes, they don't go to school, they are being abused by those older men. So that's how we come in to provide sensitization. Another slide. So we do sensitization and training after realizing that the baseline findings is out of need, there's poor sanitation, poor hygiene, unsafe clean water, people are dying, people are looking so pathetic. We come up with a number of sensitization and training. In that picture, we are training the health groups and the people in the best wash practices like hand washing, personal hygiene, and all of that. In this photo, we want to establish, we really establish the sustainable structures, communities, like community monitoring teams. So there we are taking them through the way they have to monitor, record keeping. So their major role is promoting of hygiene and sometimes monitoring, so that we want to see the results in a home state, that a home has a basic hygiene and sanitation facility at the end of the day. Another slide. So we do MHM, as we realize that most of the girls, adolescent girls, use all drugs. Some even don't use any. That's why they miss out classes. We came up with training of adolescent girls in making of reusable sanitary pads. For this case, we always train both boys and girls. We don't discriminate. We don't isolate the boys, because also the boys can be perpetrators of the girls. So we always combine them together so that we do away that stigma. So we always train them in theoretical and practical making of reusable pads, as you see in the picture displayed. Another slide. Among the successes we have since 2017, with funding from Aidlink, those are some of the water sources being constructed. As you see in the background of the area, those are the typical Karamajong houses. They are like that, shaped like grass, touched with soil, with sand. They live in manyatta. The manyatta is like a homestead whereby there's a parent, children, everything, the in-laws. So here, this is a well-fenced water source constructed by VAT with support from Aidlink. Another slide. Also water sources, the newly constructed water sources. We always train the water user committees to manage these water sources. As you see in this photograph, the water source is clean, well fenced, so that to do away with those animals which come to disturb the water source. So as already mentioned, women and girls are very responsible for water correction. They move all the way to correct water, at the same time cooking food, nurturing the children. So a lot of work being done by women. That's why in sensitization, we always focus women so much, we always involve them so that they understand and they're involved in the project. Another slide. So after realizing that the children in Aidlink study under the trees with support from Aidlink, so since 2017, we set up 12 semi-permanent classrooms like that, simple iron sheets, the timber, and we provide with them the deck so that we increase their level of education, because at unsafe, schools are a central place for learning, schools are so safe, schools keep our children safe, the girls, so that they are not usually abused by these older men, so that they have those future plans for income generation. Besides this is a latrine which is constructed by Vadoso, because we realize that people do open defecation, so really want to improve their health status by constructing such latrines. Another slide on. Yeah, we do as now we are launching water. We've already done for the two. We've been commemorating the International Water Day with support from Aidlink. So this time around was 2018, whereby we were commemorating it with our communities of Karamoja. We want to understand, we want to make them appreciate that water is a fundamental right. Sanitation is key. So in those pictures portrayed, we are sensitizing them with use of those IEC materials, procession, like making them aware that we are walking long distances, we value water, all that stuff. Another slide. It's another slide on. So impact of when we we go to this slide, we want to sort of impact of COVID. We know COVID has been a global challenge, to everyone, but different communities have been affected differently depending on the situation and the status. So COVID-19 in Aidlink, we found that the schools have been faced with, boys have been resorted to cattle and vegging, to grazing cattle and vegging small items. So education has been challenged majorly because 15 million out of the 40 million in Uganda are children, school-going children. So they've been overstayed for almost a year. So COVID-19 has been affected them. Like in Apetolem, some girls have got pregnant. For example, in Apak district, a total of 63 girls below the age of 18 years, they got pregnant. So they lost the hope of going back to school because now they are pregnant. And also boys, the boys have resulted in trading those simple items, roasted maize for income. So they see that going back to school is like now a story, since now they can earn a little income. So majorly, also early marriages have reached to 14%. Yet underage pregnancies also rose to 25% from that 20%. So really, COVID-19 has affected major education sector. That's why we come along with Aidlink. We value education so that we want to put up the semi-permanent dollar trains so that our children come back to school so that they're motivated. So with that pandemic, Aidlink came with a response so that they to support the communities of Apetolem. We conducted a hand washing campaign, sensitizing them of the value of hand washing. So we distributed 25 hand washing facilities of 135 liters each. This was from Aidlink and also other partners, but for purposes of home trading centers, health centers, masks, hand washing, liquid soap. And so up to now, sensitization is still ongoing, thanks to Aidlink. Another slide. Another slide. So here we want to advert our future is continuous implementation of water, hygiene and sanitation activities in new parish of Napak, capacity building, and more resource mobilization. Yeah, thank you very much for giving me this opportunity and for your attention. Thank you very much.
Oh, Lillian, Lillian, thank you so much. That is just so humbling to hear these reports from the field. And of course, a key thing of how Aidlink functions and what I respect about them so much is Aidlink doesn't send Irish people to work out in the ground in Uganda. Aidlink funds local groups on the ground and everywhere they work, like Lillian's organisation, the work they do there. And as Lillian was describing there, people on $1 a day having to spend 40% of their money on medicines because of poor water quality, the things we take for granted. And I love the way you guys teach boys and girls about the hygiene, the menstrual hygiene. That's such a great idea, and that's an idea I think we could adopt in Ireland here. I would love my 12-year-old boy to be learning about these things. So that's a great idea I think we can take from Uganda back to Ireland. But thank you so much, Lillian. That was brilliant. And now we go to Henry and Dan to hear about the work that Aidlink helps with in Caritas Mado.
Yes, thank you so much for this great opportunity. Greetings from Caritas Mado, and I greet you all, ladies and gentlemen, in the name of our Lord Jesus Christ. My name is Henry Bombo, and I am the coordinator of Local Health and Development Program that is supported by Aidlink. With my colleague,
I'm called Dan Wabuhinga, the water engineer. I'm 1 year old in Caritas Mado. Greetings.
Yes, we are glad to be part of this Aidlink water webinar, a campaign of supporting our communities with access to safe and clean water. I'm going to present to you an overview of Caritas Mado's work and also our work with Aidlink. Aidlink briefly has been with Caritas Mado for over 20 years. And in these 20 years, on average, each year we have been constructing 10 shallow wells So you can see that we have over 200 shallow wells. Those are 200 villages, at least having access to safer and clean water, though the villages are more like for Masaka Diocese, which has about 9 districts. Our background, as you can see, Caritas Mado is a faith-based organization of Masaka Diocese, and it was founded in 1979 after the civil war in Uganda, purposely established to provide relief items to people affected by this war. Its strategic plan has 6 strategic objectives. One is on households having improved food security, income while conserving the environment. This involves helping farmers to form associations, to form farmer cooperatives where they collectively sell their farm produces and are able to earn more income for a better living. The second one is on provision of sustainable quality and health services. And basically this oversees all the health units in Masaka Diocese and ensures that people in Masaka Diocese have access to affordable health services. The third one is on the water, the gist of today. We look at supporting communities, reduce water and sanitation related diseases and other challenges. And as you will see from my colleague, how we have worked together with Aidlink to improve, while contributing to government's effort, the welfare of these communities in reducing the water diseases and illnesses. The fourth is to contribute towards improve the livelihood of vulnerable groups by providing social, economic, and protection services. In this, we look at the most vulnerable groups, and we have categories that we do support. And the fifth one plus the sixth one, those are administrative. The fifth one being the one we are on to right now, the fundraising for such programs that aim at improving the welfare of our communities. The last one is on building capacity of Caritas Mado, like capacity of staff, setting up policies that will enable effective service delivery to our communities. Next, and yes, Caritas Mado and Aidlink, we've partnered to contribute to the National Development Program 2, that is of Uganda, and also the SDGs. And we have positioned our resources towards, one, improving access to equitable and quality education through WASH. In this, together with Aidlink, we have provided the water tanks to the last ones that have been with 17 schools in the last 5 years, with water tanks, with the pit latrines that have washrooms and hand washing facilities. Secondly, with Aidlink still, we have supported the communities to improve food and income security by building capacity of farmers through sustainable agriculture practices, collective marketing, training them in post-harvest handling, and producing food for commercial and for home consumption. You will see that it's integrated. Yes, after some years with Aidlink, we decided to bring on the aspect of agriculture. You know, human development involves several aspects. Water, you have agriculture, you have health. That's why our project title is Local Health and Development Program. The third, we have improved access to safe water, by constructing shallow wells, as I've told you, more than 200 shallow wells since the late 90s with Aidlink. You can imagine the impact Aidlink has created to our societies. And lastly, we have engaged our communities in building their capacity, especially in lobbying and advocacy. And in this, our communities have been able to engage in planning meetings with the districts and the sub-counties to prioritize on their needs. And this is aimed at setting up an exit strategy that when even we leave these communities, they are able to lobby from these government bodies and are able to continue with their lives. Next, and yes, now this beautiful immersion program. The immersion program, it's a sharing program. We have students, Irish students from Ireland, like St. Joseph's. We've had them in 2019, thanks to teacher Margaret, and also the friends like Lou, Stephen, and Veronica. It's really a great sharing and learning from our culture, Ugandan, and also the Irish culture. What do they learn, or what is involved in the immersion program? One, they experience, both Ugandan students and Irish students, they experience the education of Uganda and also Ireland. And here they attend to school at Archbishop Kiwanuka, and they have an experience of learning, taking even lessons for about a week. Secondly, the students visit rural farming communities to practice some agriculture and also drawing clean water from the shallow wells. These are shallow wells that Aidlink has constructed. Thirdly, they practice recycling and tree planting for environment conservation. And also, lastly, the cultural exchange for Ugandan pupils and also the Irish pupils. And in this, we are grateful that teachers, like from St. Joseph's and other schools that we've had, teacher Margaret, teacher Leah, they've shared the learning of music, Irish culture with the students of Uganda. And I'm also part of the students that, like teacher Leah from St. Joseph's, has taught in music and still being taught online. Thank you so much. Next slide, Anne. Yes, the impact of COVID-19 generally in education in Masaka Diocese. The students that have reported back to school, the enrollment is low. Why? The income, most of our farmers, most of our people, communities, they are farming communities. And we lost about 2 seasons of 2019. They never gotten any income from their produces. And so they were unable to take back their children to school. Also, the rural schools have not been able to afford the SOPs, the teachers' salaries, and also you can imagine the pupils. Unfortunately, we've had 2 cases of pupils who have gotten pregnant. Yes, health still, communities have been hindered by access to services like malaria, HIV, cancer, due to the restricted movements. Also still in water, water was needed more than before. And out of 600 people that regularly use the water source, I mean overcrowded water source, about 300 people used it instead. Therefore, there wasn't enough water for drinking. There wasn't enough water for washing hands and cleaning surfaces to avoid the COVID-19 contact. Then agriculture, as I have communicated in education, on a positive note, there has been plenty of food, yes, during the COVID lockdown, but farmers were unable to transport the surplus for sale in their markets as usual, leading to drastic fall in prices, food rotting, and incurring more losses. Most of the communities in Masaka depend on agriculture for a living, yet lost almost 2 seasons in 2020. Next, Anne. Oh yeah, now I'll hand over to my colleague, the water engineer, to take you to our most priority area and the gist of this meeting, please.
Thank you very much, my colleague, Henry.
Dan.
Yes.
Can I ask you, can we go straight to the photographs and maybe you would just talk us through the photographs because the time is running away on us.
It is okay, it is okay. We can go to the photographs, maybe the challenges.
Excellent, thank you.
Can we begin with the challenges, then the photograph? Is it okay in 1 minute?
Yes.
Yes, so, thank you. The good thing, Henry summarized it all. What we have faced through the challenges now we have is the long distances in search of access to clean water. It's very crucial and it has affected us mostly during the COVID-19. Lack of water facilities at schools, like rainwater harvesting tanks, are a very big challenge to us. Disintegration of water user committees. Remember, we use the community-based management approach system where the user takes control of their water facility, but there have been a disintegration of those committees. Waterborne related diseases, when they raise, lack of hand washing facilities at institutions, big challenge, lack of funds, the resources, and that's why we are having this meeting, still a very big problem. Overuse, as my colleague mentioned, on average, a water source is supposed to be used by 300 people, but you find now the number is big. Next slide, Anne. There is a physical child abuse. Actually, this one is in relation to Vadi's presentation, where you saw girls trekking long distances, carrying jerrycans and on the heads. That is an abuse. Low production is in households. Women are the breadwinners, so they prepare food, move long distances to access water. Next. What is the way forward? We are thinking as Caritas Mado, we need to construct more point water sources. Then we have to reinstate new water user committees. There is also need to rehabilitate non-functional point water sources, the boreholes, the shallow wells, which were supported by Aidlink. There is also need to fundraise. We need more resources. We need spares to put back those non-functional point water sources in use. From that picture, you can see on the right, on my left-hand side, you realize there was a spring, a non-functional spring, and up you see cultivation going on. So the water level dropped. So the other spring is not functioning, and the children are getting water from the open well, which is risky. You can see the little boy there trying to draw water. And when it comes in the evening or lunch hour, then it becomes really a challenge. Next. You see the young girl in the photo. That is the point, the water we are having. And around noon, you find even animals drawing water from that facility. So a lot of water-borne related diseases will really arise. Next. Yeah, that is one we have in one of our sub-counties, that is Wunga, where you gave support. Next. Thank you, and thank you for listening.
That's brilliant. Thank you very much. And great to hear how Aidlink has impacted the lives of over 100,000 people through 200 wells built through the years, and obviously a long, long way to go. We will turn to Mabel now from Arue. Mabel, we just need to turn Mabel back on, and we'll thank you for your questions that are coming in and your comments. David, Ashley, Namos, Tom, Ruth, we will get to some questions at the end. And Mabel, yes, and over to Mabel now, and we're going to hear about the work of Arue.
Yeah, thank you so much. Good afternoon, ladies and gentlemen. It's such a privilege and pleasure to be on this afternoon webinar to share experiences also from Arue. My name is, thank you so much, Dolly. My name is Mabel, and I work with Arue. I am currently the executive director, but I also co-founded Arue with some colleagues. But briefly, Arue is a gender-focused organization that strengthens women's leadership. So that collectively the women can break the chains of poverty, patriarchy, class, and sexual repression. We do this through advocating for rural women's economic justice, sexually reproductive health and rights, health, especially water, hygiene, and sanitation, and helping the communities to challenge the rigid and oppressive gender stereotypes in their communities. As Arue, we envision seeing a world in which women and girls can realize their full social potential. I just want to say Anne is going to be probably sharing a small video. I had planned to share with you a longer video, but I can't see time, and also the fact that it has also failed to upload. But I just want to focus my presentation briefly on the gender as perspective, the state of water here in Uganda and gender, and sharing with you some of the experiences that we go through. I thank Lillian and I thank Henry. They have really shared already my ground, and so I'm not going to labor so much to go into the statistics and bringing the context, but just to re-echo and say that in Uganda, Lillian mentioned, women and girls remain the major water collectors, users, and promoters of water at household and community level. Now, it's one of our roles by culture, and like I said, we have some cultural norms that we are trying to fight, but that takes time. And so growing up, it was one of our roles as girls to go and fetch water. It's not only the communities where we are working in the rural areas, but even currently, some of us, even me as an executive director, the culture thinks that I should also ensure that there's water in my household. And so we labor so much as women, the girls labor so much. And so the intervention that Lillian and Henry have presented really with support for Aidlink has really helped us. And I must say that the women also, this actually has a very negative bearing on our well-being and growth, because there's the impact also cross-cuts from, let's say, for example, inadequacy, deficiency, and inappropriate water services, especially in the rural communities. One of the reasons for this state of affair is that women are excluded in the areas of planning and decision-making regarding water and sanitation development process very difficult. Therefore, women's views are often underrepresented, implying that their practical and strategic needs are not addressed at national level. And so when we come in civil society, when we come in with partners who really want to address the concerns of the rural communities, the grassroots people, putting into consideration aspects of gender, we feel very proud of Aidlink. And so the intervention, for example, at Arue, the intervention of WASH are really gender responsive. We implement projects that address both the boys and girls, but I want to specifically speak for, you know, the issues that really affect the girls, because I passed through that. I know what it means when they say we walk probably 1.5 or 2 kilometers to look for water. Personally, I've experienced it, and that's why I really have the passion.
We've lost Mabel
To ensure
there,
that the
unfortunately. Oh, she's back. She's back.
to get that done. So it's okay. I'll proceed with probably my input. So Lillian has mentioned, and Henry, that the girls are affected. Now, I want to give a case study of one of the schools that we've worked with in Changwanzi. It's called Kasolo SDA Primary School. Now, before COVID, the school had a total population of over 423 pupils, of whom the boys were a majority. The boys were about 265. Now, during our intervention, we came to learn that normally the girls' population in lower classes is really higher compared to the boys. But when it comes to the higher classes, for example, when the girls become adolescents, the population of the girls drastically reduces. And one of the factors, the reasons that the teachers and pupils mentioned in our survey is due to lack of water and safe sanitation facilities, mainly to cater for the girls, especially when, say, for example, they are having their menstruation management. Now, Lillian has shared, and we have also witnessed, that because the water sources are really far, the water sources are really open ponds before we get into the intervention. It's usually the bigger girls who the teachers will send to get the water. And so the girls get tired. They feel that school now is a burden because you have to collect water. You get to move that long distance, as Henry has also mentioned, with a big jerry can of 20 liters. And that you don't do one route because the school needs water for cooking, for cleaning, for, you know, hand washing. And so the girls would take, for example, 3 or 2 routes in a day to get water, which is enough. Now, the issues that they've been sharing, including safeguarding issues, because sometimes the teachers are busy in classes, they will not accompany the girls. And so the girls mentioned that they really get abuses from, you know, from the men and other people in the communities. Words of abuse, you know. Sometimes we have a school that actually reported defilements because of these movements that the girls do. So we found that in the schools that we are working with, girls decided not to actually get into higher classes, P6, P7, and P5. And so they dropped. Leave that alone. They become so tired. And so because water for us, the saying that God's water is life is so true in our communities, because if without water, it means the school won't be open. And so the girls, when the girls do the movement of water, remember they've already mentioned the water is not safe. Their ponds, they're shared with the animals, very unsafe for them to consume, say, for example, to drink, and also to clean their facilities, say, maybe cups for drinking. The girls mentioned for a fact that they are really tired. And the time they get to class to concentrate, they are so tired, including the boys, because also the boys go to school. And so the teachers confirmed that these times that the girls waste and the boys, the pupils waste collecting water really affects on their academic performance. So you find that the retention in school has been affected because of lack of water and safe facilities. You find that the academic performance is really affected. But not only that, the really water and sanitation related diseases, for example, diarrhea and typhoid and all that, because there's open defecation, the ponds are really affected. And so those challenges really affect the girls. And what makes the situation really worse is the fact that the girls use reusable pads, as Lillian mentioned. The reusable pads require water to wash to be washed such that they can keep them safe probably in their bags, or for example, to take them back home when they are clean. Now, when girls come to school and there's no water to help them manage their menstruation hygiene safely, they will definitely decide to stay home for those 5 to 4 days every month. That means it gives really a upper hand for the boys to participate well, because the girls will not perform well. They will be at home really waiting for that time. And besides, the facilities usually at the schools are not safe. They are not gender friendly, and the girls require gender sensitive toilets, especially the adults and girls, such that they can enjoy their schools. And so these interventions have come in with support from partners like Aidlink to bridge that gap, to bridge the gender gaps, to ensure that the girls stay in schools. And so currently in the school in the video that I wanted to show you, the girls have safe water, they have a borehole, they can now get the water wherever they want. And sorry for biasing on girls, but the boys also, I should say boys and girls in schools have the water.
You don't have to apologize.
Yeah, because water makes a lot of sense to girls and mothers and women. I think that's why I think it is something that is on our hearts as women. So now they're free, they can enjoy the space at school, it's safe. They are not intimidated by, community members who are not friendly, safeguarding issues of defilement. They can get the water anytime, they can concentrate, and the toilets are there that are gender sensitive, designed for both to cater for girls' needs and the boys' needs. And it has really remained the safe water at school and sanitation facilities has really turned the story into a positive story. Sicknesses, as Vivian has mentioned, has reduced. Time and then concentration.
That's brilliant. Mabel, thank you. And maybe you'll be delighted to hear that Anne will share the link for your video when sharing the recording of this. And I was getting so annoyed listening to you talk about what the girls have to go through and the idea of being taken away from school just to carry water. There's so much to be solved, and you've all got so much patience. And Anne is going to announce something now which is going to help move things along and further Aidlink's work. So thank you very much, Mabel. And back to Anne now as we wrap up for this lunchtime.
Look, I want to say thank you to everyone in the audience for joining us today. Of course, a huge big thanks to our friends and partners from Uganda, to Lillian from VAD, to Henry and Dan from Caritas Mado, and of course to Mabel from Arue. I think there is something really special, and maybe I see Ruth Ferris talking to us there. And I think it might be true that one of the advantages maybe, or one of the positives to come out of this COVID thing, is that our ability maybe to connect you all together. So I want to thank our guests from Uganda, and to thank you all for being here. I think you won't be surprised, I suppose, having listened to our speakers today, that we do need your help to continue to do this work and to expand this work. So from now, today, we are asking you to join in our Walk for Water campaign. We're inviting you to walk in solidarity with the communities that we've spoken about today, to raise awareness about the issue of water poverty, and indeed, if it's possible, to raise much needed funds so that we can reach out to these communities with more water, community water facilities, and school water and sanitation facilities. We're asking you that in line with COVID-19 restrictions, that you will mobilize your families, your friends, your school classmates, your bubbles, and take on a challenge to walk 15,000 steps in solidarity with these communities. You can set a time and location to suit yourself over the next month, and that if you are in a position to do so, that you will raise funds, and you can use the Give and Gain link that will will be sent out to you. You'll get lots more information about what we're doing on the website, And if anyone wants to get in touch with us directly, please don't hesitate to do so. And you can do it on info@aidlink.ie. Again, my sincere thanks to Donal, to our friends in Uganda, Lillian, Mabel, Dan, and Henry, of course, with all your friends from St. Joseph's and Rush and Loretta Beaufort and Rathfarnham cheering you on, I can assure you. I hope that it will be that someday, not too distant, we can return to you. Thank you very much, everybody. Donal.
And thank you so much. And you can sign me up for the Walk for Water. I'm
Excellent.
going to be doing it and getting as many people to do it as possible. I can't believe the work that needs to be done and the scale of it. And more credit to all of your patience and hard work. Mabel, Lillian, Henry, Dan, Anne, thanks a million. What a lunchtime this has been. Thank you. Thank you all so much. And thanks to you all for tuning in. Amos, sorry we didn't get to your questions. I think they were answered in the context of a conversation. I hope you're happy with that. And to reiterate Eileen Bowen's comment, thanks to everyone. You were terrific. And Ruth Ferris, yes, you're right about Zoom. As we said, thank you everyone. And enjoy the rest of your day. And let's all get as many people as possible to Walk for Water and keep this amazing work going. Bye.
Thanks, everybody. Bye-bye.
Bye-bye.